Hello, everybody. This is going to take me a minute to get used to. I assume you could all hear me. Yeah. All right, cool. So, yeah, I think that's an important distinction. Oxygen is an ingredient required for health. If you don't believe me, hold your breath for the rest of the talk. You'll figure that out pretty quickly. And so, we could use this in very severe and very life-threatening conditions. We could also use this, as we were saying, for moderately healthy people trying to optimize. It's just utilizing oxygen for the varied benefits that hyperbaric, or that oxygen in general, has for all of us. And so we're going to talk about hyperbaric's effect on stem cell mobilization, cell signaling, cell regeneration, but most importantly, I believe that hyperbaric specifically is probably the most misunderstood and underutilized therapy in existence. What it does and its ability to impact people is far greater than most of the other modalities and tools that are out there. And I'm not saying that the other ones aren't great. We have them, we use them. Melissa earlier was talking about our wellness center that we have. We use sauna, we use red light, we use PEMF, we have chiropractors, massage, acupuncture. We offer a lot. But hyperbaric is incredibly unique with the way that it's actually able to deliver what it's delivering for us. So I get the opportunity to lecture all over. I'm on the International Hyperbaric Association board and faculty. I'm also on the International Board of Undersea Medicine board and faculty. And so I teach hyperbaric medicine. I certify technicians and practitioners in hyperbarics all over the world because I'm trying to get this out there. Hyperbaric's been around for 350 years. And it's only in the last 3 to 5 years that it's even come into most of our consciousness. I've been doing it for about 20 years in our office, and I've been teaching it for the last 6 or 7 years, but my goal is to really help grow this field, grow this industry, because it is so incredibly impactful for the people that need this therapy. So we've had this conversation a number of times. I'm not going to belabor it, but the idea that once upon a time, we had shorter lives. We had a very short, 30s and 40s was our total lifespan. But we had very high health up until the point that we died because we were dying from trauma and infection primarily. Nowadays, we actually have pretty well extended lifespans. To live to the mid-70s, late 70s, early 80s is very common. Centenarians are one of the largest growing percentage-wise populations in the world. So we're already reaching some limits of longevity. However, our health span is not catching up. So our health span is at about 65, whereas longevity sits at around 78 to 82. And so we have this 15 to 20 year massive decline in health, massive decline in quality of life. And the worst part of all of that is it's lifestyle disease. We're literally killing ourselves with our environment and our lifestyle choices, and we're the ones really helping to accelerate our aging process, our biological aging process, even though we're extending our chronological age. At some point, we're hoping to get bio-optimization. That's why we're here. We're here to figure out ways, tools, strategies, and combinations of strategies that really not only improve our health, but also continue to push our limits on longevity. One of the most important things I can show you, I know you can't see it, so if you want to look this study up, please take a picture. This was a meta-analysis looking at 51 different longevity strategies that they had and wanted to compare the data of this research to see which of the 51 were most and least effective. Now, this isn't just longevity on healthy people. This was looking at longevity of sick people in disease models, and it was looking at longevity inside of healthy individuals as well, okay? So there are 51 different strategies brought out on this. I know you can't read them, but I'll bring some to your attention. But essentially, on one end, you'll see these were the least effective out of the 51, and on the other end, the most effective. And so this is just a scale from least to most effective with regard to the impact that these strategies had on longevity. And just to categorize some of them for you, you'll see that they looked at 7 different diets: Mediterranean diet, omnivore, high carb, low carb, vegan diets, and they all had pretty good impact, but they were pretty well clustered in the middle. So they thought, well, maybe it's not just diet alone. Maybe we need to combine diet and exercise in order to get the impact that we were looking at. So we combined diet and exercise, and they're still pretty well staggered in the middle. And so, not that they're not impactful, they absolutely are, but they're still not really the further end of that spectrum. Next, we could look at disease models, but medical intervention. So obviously things like gastric bypass, if someone was morbidly obese, kidney transplant or kidney dialysis. You know, these are medical interventions on very sick people, and so clearly they're going to have some effect, if they're working, on that diseased model person's longevity. Next, we could say anti-senolytics or rapamycin, if you're familiar with those. But these are either medications or supplements that people take to try to get rid of senescent cells primarily. And on the lower end, here you'll see rapamycin models. And at the higher end, you'll see anti-senolytics, specifically when combining DQ and DQF senolytics as a strategy for longevity. Next, we could say, well, how about vitamins? Well, vitamins like folate or omega-3 oils or immune stimulants, also pretty well spaced out throughout all of those longevity models. The absolute most effective strategy for this longevity project was in 2 other disease models. One was HIV. So the most effective and the third most effective inside of this was taking antiretroviral medication if someone was diagnosed with HIV. Makes sense if you take the right medication and you have HIV, not to develop into AIDS and die prematurely. The second most effective was metformin, but only in a disease model. I know people promote metformin in a healthy model, but this was only looking at it for type 2 diabetes and impact, and that was the second most impactful. The fourth and fifth were both high pressure hyperbarics and low pressure hyperbarics. So even across all of these 51 strategies, even including diseased models, hyperbarics, both high pressure and low pressure, were the most impactful. If you remove HIV and diabetes as a category inside these 51, hyperbarics was the most effective strategy in longevity. And so again, I'm saying that just to remind you that this is probably the most underrated therapy in all of hyperbarics. How many of you have heard of hyperbarics? How many of you have been in a chamber, right? So in the US, it's growing like wildfire, thankfully. Outside the US, it's been a little bit slower uptake. But again, I'm really trying to dedicate myself to getting this information out there because I know how important it is. And if you have a chance, you know, you could utilize at least some of the equipment that's here at the show. You really should if you've never been inside a chamber. So what does hyperbaric do, and why is it so unique? What is it doing that is so specific and really impactful from a physiological standpoint? There's really 2 pathways. One is oxidizing your fuel. So just like in a car, you need gasoline and you need air. And the air is what oxidizes the fuel. If you had all the gasoline in the world, but you didn't have the right airflow, you would never have combustion inside that engine. Likewise, in your body, you could put all the right fuel in, your diet could be perfect, but if you have even small amounts of hypoxia, which many people do in a variety of places in their body, you will not oxidize that fuel. You cannot make cellular energy. So that's one pathway. The other pathway is as a cell signaling molecule. As a cell signaling molecule, oxygen stimulates immune system function. It stimulates the repair and regeneration of cells and tissues that are damaged. It helps to get rid of senescent cells, and it stimulates and mobilizes our own internal stem cells for, again, repair and regeneration. It acts as a nutrient inside of our body. It acts as a vitamin inside of our body, and it even acts as a cofactor inside of our body. ATPase, which is the last step of energy production inside the mitochondria, is oxygen dependent. And as a result, it actually helps stimulate that enzyme from being able to work, making enough ATP for your body. I think many of you already know this, but you can go days or weeks, even months without food. I'd argue that if most people actually went weeks or months without food, they'd be healthier than most of their current lifestyles. How long can you go without water? A few days, really. How long can you go without oxygen? Literally minutes, right? And what we could do is we can put oxygen as a vitamin on a continuum. Let's use vitamin C as an example. If you don't get enough vitamin C, you can get a disease. What do we call that? Scurvy, right? And so you certainly don't want scurvy. The RDA, at least for us, the RDA is the recommended daily allowance. The RDA is basically how much of a vitamin do you need not to express signs and symptoms of the disease, right? So you would certainly want enough vitamin C, the RDA, so you don't get scurvy. But you and I would also agree that you don't want the minimum amount necessary to not have disease. You want the optimum amount. So you can get the optimum amount of vitamin C every day, day in and day out, so you have enough vitamin C to do everything that vitamin C does inside your body, but you still actually may choose to megadose vitamin C periodically. Like, let's say you were getting sick, you might take even more vitamin C for a short period of time. Let's say somebody with cancer wanted to look at high-dose vitamin C IV, really megadosing vitamin C, because for a short period, it could play a very different role in the body. And if you megadose long enough, you could also find toxicity of that exact molecule. So as important as vitamin C is, in really high doses, it could actually be toxic. I would say that oxygen can live on the same continuum. If you don't get enough, which many people in their bodies aren't getting enough periodically, we get a condition, we call it hypoxia. So you don't want hypoxia, you want enough oxygen so that you can actually function day in and day out. So the RDA equivalent, if you measured it on a pulse oximeter, would be like a 92% saturation. That's okay, but you don't want that. You really want to be fully saturated, 98, 99% saturation on a pulse oximeter. And most of you, if your heart is healthy and your lungs are healthy, that's where you are right now. Could you ever be more than 100% of anything? No. And so if you're already carrying as much oxygen as your body could possibly carry, how could you ever megadose oxygen? How could you ever get more oxygen than what you're getting right now? The only answer is through hyperbarics. Oxygen absorption is driven by atmospheric pressure. So until you can change atmospheric pressure, which you and I have no control over actual atmospheric pressure, but until you actually manipulate atmospheric pressure, could you actually change the absorption dynamics of oxygen? When you're inside of a chamber, even if you don't add additional oxygen, you're driving additional oxygen into the plasma of the blood. And that's really the only way to get an appreciable amount of oxygen greater than what you and I are carrying right now. So what is that? Basically, you go into a hyperbaric chamber. That chamber is pressurized, so it's creating a temporary increase in atmospheric pressure. And you could be breathing air or you could be breathing oxygen. And in either case, you're going to be absorbing oxygen at a much greater rate than whatever you are getting right now. We can equate this to a bottle of seltzer. You pressurize a gas, in that case we're using carbon dioxide, and you hold it over a liquid, in this case we're using water. And as you pressurize that gas, holding it over a liquid, you can dissolve that gas into the bottle. And if I had a bottle of water and a bottle of seltzer next to each other and you couldn't see the label and you couldn't touch it, you might not know which one was different. How would you know? I could show you the label, or we could open the bottles and spill them out, right? Once we do that, one was already in equilibrium with the environment, and the other one had this pressurized gas that's now trying to come out. So with hyperbarics, there's two phases of the treatment. There's the time you spend in the chamber, which is driving increased amounts of oxygen into your circulation. And then there's the time you spend outside the chamber. So in hyperbarics, we're pressurizing oxygen. As we pressurize oxygen, we're driving more into circulation. And again, as long as you're in there, depending on what pressure you're using, what percentage of oxygen you're breathing, and how long you stay, those are the three factors that determine how much oxygen you're actually going to absorb. But what happens when you get out of the chamber? Just like that seltzer bottle starts off-gassing, the same thing happens inside your body. We pressurize the gas, you get out of the chamber, and now that gas can no longer stay inside. Now, in a bottle of seltzer, it's just going to evaporate into the environment. But in your body, that's not what it does. In your body, as it's coming out of circulation, it's actually migrating to distant tissues and distant cells that were already hypoxic. How many people, I mean, there have already been a number of talks. How many people have increased levels of stress? How many people have scar tissue from old injuries, toxicity from your environment, chronic inflammation? This all becomes barriers of oxygen diffusion. But when you pressurize the gas and you allow it to come out, all of a sudden, oxygen is getting into all these nooks and crannies that under normal atmospheric pressure, it was impossible to happen. What are some of the benefits or what happens to your body as a result of hyperbaric? We can categorize it into 4. Mechanical effects, which is really more to do with diving accidents than anything else. Hyperoxygenation, meaning we're driving oxygen into the mitochondria, which is allowing us to increase the amount of oxygen getting to the mitochondria for energy production. The immunological effects, which are controlling of inflammation and stimulating the immune system's ability to fight infection. And then the regenerative effects, which are really what most of us are interested in here with growth factor release, bone stimulation, cartilage, fibroblasts, skin, and eventually stem cell mobilization as well. So from a bio-optimization or from a regenerative medicine side, 75% of the benefits of hyperbaric apply the same way they would even as it relates to, let's say, chronic illness or utilizing hyperbaric in a hospital setting. As we were talking earlier before I started this lecture, it's the same ingredient, but you can modulate or alter the dose, the frequency, and the delivery, and more severe or more chronic issues need a much more significant protocol, and less severe, let's say more bio-optimization, can get away with a much less intense protocol, but we're still using the same tool and the same ingredient. I like to break these down into short-term and long-term impacts. So short-term could happen in every session, every 3 sessions, 5 sessions. You get upregulation of ATP, you get reduced swelling and edema very quickly, you start getting decreased inflammation, improved tissue perfusion, immune system regulation, and a balancing of the antioxidants inside your body. So those happen very quickly. However, a lot of the benefits that you and I are interested in are really what I would consider the long-term benefits. The long-term benefits like building new blood vessels, right? Increasing microcirculation vascular beds, neuroplasticity and healing of the brain and the central nervous system, killing anaerobic infections, getting rid of cellular senescence, and then changing epigenetic expression or mobilizing stem cells. This is really a minimum of 15 to 20 hours, but really that's where it starts. 30 hours, 40 hours of treatment over the course of like 2 or 3 months, that's where these massive cellular changes occur. And once you actually start shifting, let's say biology and cellular metabolism, you actually will keep a lot of those benefits long term, even if you chose to stop the therapy. So getting to that point within your first protocol or 2 could really change your health for years and years after you stop the therapy. I did my own study about 2 years ago while I was finishing a PhD in molecular biology at the University of Miami. And what we were doing, we were comparing lower pressure to higher pressure, because I get that question all the time. You've probably seen soft chambers, you've seen hard chambers. Which one do I want? Which one do I need? You know, some people like to say hard chambers are the only way to go. Some people say soft chambers do everything hard chambers do. I'm like, I'm sick of having emotional conversations about things that we have no data. Let's actually do it. So we did essentially we did a 3-month study comparing low pressure to high pressure. We found a lot that I can't cover in the next 90 seconds, but what I will say is both are incredibly effective. We lowered inflammation at both pressures. We changed cognitive performance at both pressures. We changed mitochondrial function at both pressures. So we reduced inflammation, we altered biological age at both pressures, but we also did it differently. So you could use lower pressure and get all of those benefits. You could use higher pressure and still get all of those benefits. But again, the frequency and the duration, how you create the protocol will be very geared towards what are your goals? What are your issues? What are you trying to accomplish? Most of the work that I do outside of, let's say, traveling and getting to lecture to groups to educate people about it is protocol development. There's very few people all over the world that are now getting into hyperbarics, but they still don't necessarily know how to utilize it. So I'm consulting for a number of organizations all over the world, helping them develop these protocols, because that's the key. The tool is only as good as the protocol is to deliver it. And so we've learned so much through the research that I did, and now studies that are coming out after this research that support this and new protocols to really understand how to best use and optimize this therapy. This is not a perfect example, but I try to get people to understand what's foundational in your life versus what's not foundational in your life. I love peptides. I love red light. I take supplements. I try to have a good diet. I exercise myself. But there's so many strategies to choose from. There's so many different things we could be doing. What are the most important? How do we figure that out? This is just Jason's opinion on life. You have to get the components that affect every system, the things that are the most foundational, are going to be the things and the strategies that impact all of your systems, right? You have to have a healthy diet. Who doesn't know that? You have to exercise, but you can't exercise your way through a shitty diet, and you can't eat your way throughout a sedentary lifestyle. You need both of them. You need a healthy mindset. You know that. And I want to say that oxygen, I believe, is foundational in that way. Only similarly, but slightly less important maybe, but it's hard to even say that, quite honestly, would be something like the right amount of light, the right frequencies of light. I know we've had a number of talks on that. And then clean water. These are things that affect your entire body. Once you've nailed those, then you could start using targeted therapies, like targeted peptides for this particular goal. But if you eat like shit and you don't exercise and you're not, your mindset isn't straight, right? You're not getting good oxygen, you're exposed to too much light, you have terrible water, and you think one targeted therapy is gonna be the answer to all your problems, I'm sorry, there's no chance. Do you understand the difference? So we have to get foundations set right, and we start building on the next layer of foundations, and then you have a few things left over. Whatever those issues are, whatever those goals that are left over, once you have a solid foundation, now you could start using targeted therapies to really elicit specific responses. So that's my strategy as far as, and I wanted to leave you with a thought process after today's talk. And then, since I'm out of time, real quick, if you're interested, we do have a YouTube channel. I have like 650 something videos, I don't even know, on YouTube on very targeted conversations. So that you can digest hyperbarics in very small snippets. So feel free, scan that, take a look, and then you can contact us through there or through HBot USA. Happy to answer any questions you have. I have no time, but I'll be hanging out at booth 49 for a while. If you have questions, please stop by, let me know, and I appreciate your time and attention.
Thank you so much. Oh, you get to stay here a little bit.
Oh, I could stay here.
Yeah, you can stay. We can have 5 minutes.
Okay, I
have a few questions for you actually.
Sure.
Because I think, obviously, extremely interesting, fascinating. I love the idea of looking at it like Maslow's pyramid. Like you're putting oxygen down there. Obviously, you're the expert in there.
I might be slightly partial.
No, well, that was my next thought. Maybe you're a little partial there, but let's just leave it at that. It is your stage. A few more minutes there. But if you were to put together, if you're a normal, healthy person, like the most people who are here, who are interested in longevity, interested in the whole space, where would you start? Like, give us your go-to regime in terms of duration, how often, soft, hard. Like, where would you start?
So, I mean, even people coming to my office for really severe issues, we always start at mild pressures. So whether that's a hard chamber at a mild pressure or it's a soft chamber, because that's all it does is mild pressure.
So you can only do
we always start low and build up over time.
Is that because the body needs to?
I think like everything else, finding the minimum effective dose is really important.
Yeah, okay.
And as powerful as oxygen is, a lot of people want to say, well, if a little is good, more must be better.
Yeah.
And hyperbaric, that can be less true.
But it's like with everything in longevity, it's a U-shaped curve.
It's a hormetic stressor like everything else, and we have to find balance.
Okay.
So we start low, we build it up, we find your sweet spot, and then we usually stay pretty close to it.
But how long are you normally in? You're like an hour and a half?
A typical session would be 60 to 90 minutes.
Okay, and you also have your head inside, or is the head out?
No, your whole body.
I feel like I've seen like photos from like olden times where people sit with a little head out.
That was the iron lung.
Okay, that's the iron lung. Okay, I'm thinking about that. Is that the same? No, it's not the same.
No, that was to help people with polio breathing.
That's not my problem.
But yeah, this is like your whole body is inside that chamber. You have to get used to being inside that chamber, which for a lot of people takes a minute. But we've been able to overcome that in most situations.
Can I use my phone in there?
I would say no.
Can I bring a book?
Yes. Read, breathe, relax.
I can't breathe for 90 minutes. Are you insane? That would never happen.
You breathe all day. What are you
No, I mean, I would.
You could do breath work for a part of that.
Well, I could.
Most people take a nap, right? I'd say go in with a book, read a few pages,
Okay.
get a little sleepy, take a nap, wake up, read a few pages.
How does it
get
feel?
up.
Like, and there's another question I have. Like, how does it actual feel?
You wouldn't know you were in anything. right?
Really?
So you'll notice that your ears pressurize, like an airplane.
Yeah.
You'll feel pressure in your ears. You have to manipulate, do some Valsalva or yawn or swallow.
Yeah.
But once you're at pressure, you would have no idea. You don't feel pressure on your body, your arms, or your legs. It doesn't feel any different inside the chamber than it does out here. It's just the first 5 or 6 minutes that you're adapting to the pressure that you notice it.
I think a lot of people, including myself, are always looking for quick fixes.
Yeah.
You must get this a lot. But you actually, in some way, I know there's a barrier because you need to buy a $100,000 hyperbaric chamber. But other than that
don't
small,
have to-
slight little detail, then it
You could
also...
go somewhere and get a chamber. There are chambers that are like
And actually, Tina just bought one, I know, for her clinic, the one who runs this. I'm going to go try it out. But if we look past that, this is actually, if you're right, I'm sure you are, this is one of those interventions that have zero to little impact. Like, you don't have to
Negative.
kind of, like exercise. Exercise is a huge barrier because people don't want to, I don't feel like running, I don't want to go outside, I need to go to the gym, people smell, and it's all these bros, I don't like it.
super passive. All you have to do
very
is lay down
Yes.
and breathe.
And also
from
the-
that standpoint,
like-
it is time consuming.
Yeah.
And it can be expensive, but it is passive, so it's easy to do from that standpoint. But I can promise you this, I've never had somebody go into a chamber and do a protocol and say,
Yeah, no.
nothing really happened. Like, that's never happened. I've had people do a session or two and then drop out early and be like, I tried hyperbaric, it didn't work for me.
Okay.
But they didn't they didn't go through the program
And
that they needed to go
Okay, and
through
then my
to
next
get
question is, sorry, just taking over this whole thing. How many would you do, like yourself? It's
mean-
always interesting to have the guy
Sure.
who's, do you walk
I've
the
never
walk?
been in a chamber, actually, in my whole life.
You're kidding.
I'm just kidding.
Oh my God, I just thought you were. That you just,
I'm afraid of that
There's a
now.
whole void. Yeah, it's not for me. I'm not onto that. No. What would you?
Yeah, I mean,
like,
so I've done thousands of hours I've been doing this for 20 years, right? So
every
I
week-
never counted. I wish that I counted.
Okay, yeah, sure.
Today, my program, I do 1 to 2 hours a week. That's it, max. But 3 or 4 times a year, I do 20 to 30 hour clusters. So I'll do like 60 to 90 minutes almost every day for like 2 or 3 weeks.
That's
And
what
then I
want.
won't do that.
I'll do that.
Right.
Can I start with that? No.
Those clusters are really what give people the biggest impact.
So you're saying like, how many sessions over like a
So
month?
let's just say 20 to 30 hours in like a 1 month period.
Done.
And then
Let's try
that's
it.
easy, and
I'll
then-
text you.
Please.
I'll write you and see how that feels.
I would
So
love
even
that.
though if you're already healthy, you would still recommend.
Oh, yeah.
It's not like
You'll see change, like everything people have talked about, their stress levels, their HRV, their resting heart rate. If you track your health, through a wearable of some kind, guaranteed changes on deep sleep, REM, and heart rate variability.
Exactly. Okay, so that's my last question. Sorry, I'll let you go because it's just, it's
I mean, I could
very
stay all
often
day.
we have guys like you.
Hang out.
So what would you track if you were to try this? Let's say you wanted to none like 5 people had been in a hyperbaric chamber, probably none had did that whole protocol you talked about. What would you track before and after? Like where would it
I
be
mean, the easiest thing is a wearable. If you have that,
yes,
you'll see those changes.
But if you wanna, like, add a little
take
to
like
that.
the next level, I mean, part of our study was biological aging.
So like an epigenetic or
Epigenetic, like a true age or true
yeah, okay.
diagnostic. Or
I'll do that.
Those
Okay.
are absolutely. I mean, that's the data that came from that 51 strategies I showed you. That data came from my study, as far as the hyperbaric data, at least.
So an epigenetic or like a Horvath's clock or whatever, like kind
Exactly.
of. But in 1 month, you will be able to see a difference. You think?
You will see, I mean, based on our study, so we did basically 3-month study. In the first month, lower pressure had reversal of biological age. High pressure had accelerated biological age.
What?
So the opposite that you would think. By the end of the study, low pressure continued to reverse and high pressure caught up and then
And superseded it.
Right.
Okay.
But in that first month, actually the opposite occurred. So just to be aware.
It gives an additional stress the first,
It's a bit of a stressor in the first.
like
at
going to
higher
like
pressure.
a sauna of like 24 hours a
Right.
day.
Well,
Obviously, that's
yeah,
not a good.
too much.
Okay. Does anyone have like one question, last question we can just ask? Yeah. Can you say it real loud? That's just easier.
Just wanted to hear about. I also heard the
Like,
Hotel rooms with hyperbaric.
wait, do you mean a hotel that has a chamber, or are you saying pressurized hotel rooms? So there are pressurized, I mean, people are building houses at altitude
Can I-
and pressurizing their bedroom. I've only recently heard about hotels also thinking about doing this. Essentially, it would help, like if you have I don't know anybody doing it at sea level for hyperbaric purposes. I only know about people doing it at elevation to try to reduce the impact of high altitude sickness when you're first adapting to high altitudes. But certainly I know quite a few people built their own beautiful mountain home for their family, and all the bedrooms are pressurized to basically go back to sea level. That wouldn't be hyperbaric, but it would reduce the the high altitude sickness.
Could I make a hyperbaric chamber in my entire house?
I've had some builders ask me the questions to try to get to that place, but I haven't seen it happen yet.
Okay, last question. Would you run the risk of blowing up?
So, I mean, because of all the electronics and all the things in the house. So essentially, it's not a lot of pressure, so it's certainly lower pressure than like most hyperbaric chambers would go to. But also, it wouldn't be adding oxygen, right? So it would just be air, pressure, and even less than a mild chamber typically pressurizes that. That's a great question, thank you. Wait, no, don't do that. Yeah.
Please don't blow up.
All right.
Jason,
Well,
thank you
very much,
so much.
guys. I
Really
appreciate
appreciate
your
it.
time.
Big round of applause. Thank you, guys.